I'm Dr. Hal David Martin. We're here today to try to do a physical examination to just do a screening process for the non-orthopedic surgeon to help them to recognize the interrelationships that exist between the hip and the pelvis. So first we're going to do a standing exam, a seated exam, a supine, and a lateral examination with just a few specific tests to kind of keep this very brief. But it's very important that we learn to recognize the interconnection that exists between the spine, the hip, and the pelvis, and that we have a way to screen out these complex pathologies that do exist and coexist. So are you ready to get started?
Yes.
If you had pain, where would it be?
It would be right around here.
Okay, great. So the first thing I like to do is just go into the hallway and watch you walk. So let's come into the hall. And as you walk down the hallway, I just want you to take a normal stride length right on down through there. Can you just walk normally? Normal stride length. So she doesn't have good arm swing. Her arms are kind of at her side. Now turn and come back. And this time I want you to take a long step. Does that increase pain in your hip or your pelvis? Reproducing the pain that you have? No. Fantastic. If the pain in terminal lip extension recreated your pelvic pain, that would suggest a hip problem. I just kind of look cursory. The shoulder heights are symmetric, leg lengths are equal, her sagittal plane balance, her ear is basically over her hip, and that's where we want it. But we want to kind of just look at the general posture, and that looks good. We're going to bend over and touch your toes and screen the spine. The spine is straight, and back up straight for me. Good. And now I want you to just extend back. So we're going to look at end range motion, and now the other direction. And that doesn't create any pain down into your pelvis or to your hip. Is that correct?
It doesn't.
Fantastic. There's some other tests we can go into, but we're going to just keep this very brief for this segment. This is the way we do the sitting examination. She's a medical student, so she's learning all this as well. So this is just doing a straight leg raise in the sitting position. It's the way we like to do it. It's just to keep an order and structure to our examination. Does that feel the same to you on both sides?
Yes.
All the way around? Good. And you can also just check the DTRs in this position as well. We like to check the internal and external rotation because that can really affect the kinematics of the entire hip. So 20 degrees is normal, and that's normal internal, and 45 degrees is normal for the external. And just one last little screening test for the back is we like to do a slump test. So slump your shoulders all the way over. That doesn't create any of the pain that you're having down into your hip or to your pelvis, right?
Nope.
Great. Next, we're going to check just kind of the end range motion of hip flexion to see if it creates any of the pelvic pain. So we like to just bring the hip up, do flexion, adduction, and internal rotation, because sometimes whenever the hip doesn't fit in the socket, it can pull on the pelvis and create pelvic pain. So in this position, do you have any pain at all?
Nope.
No. Great. We're in the lateral position for the right hip. And so what we want to do here is, as we've checked the end range motion in flexion to see if it creates the pain, we want to check the end range motion of hip extension. So what we're going to do is I'm just going to take Shreya's leg all the way back here, as just like she did when she was walking actively. We're going to check the passive terminal hip extension, and she has no restriction. If it gets restricted, this is in an abnormal position, but it will look more like this. And that will start to pull on the pelvis, and that's an abnormal finding. Next, we want to check the strength of the Gmax and Gmed combined. So just lift this up to the ceiling as hard as you can. Lift me all the way up. Because dynamically, that can affect the spaces of the hip. If we don't have good strength here to hold me all the way up, try again. If we don't have that perfect strength like that, then it can collapse and create the first condition that we were talking about. So that was just a very simple, basic screening examination for non-orthopedic surgeons in trying to sort out the complexity of hip, spine, pelvic core pathology. And it's important that we really understand anatomy so that we can build upon that with the biomechanics. And then through that direction, we can come to interpret our clinical examination better and help get to the patients to the right surgeons or physicians or therapists. And I want to make one specific thing about the therapist, because most of these conditions, the most important thing about treatment is proper diagnosis.